we have different wheels of advocacy. So I myself am an insurance certified navigator for over 10 years, and I assist families in getting insurance when they need it. Our primary care wheel, we have medical care, dental, behavioral health services, and then our most new services is really establishing a school-based health center, which we'll talk a little bit more about today. And then our wellness both. So we have youth programming happening at the schools, as well as wellness and other programming happening in the community. So what is the situation? More specifically in our Fairville community. We'll talk about this on this slide. And so the Fairville Public School District is a majority minority district. About 61% of those students are BIPOC students. So 24% of them are in EL classes, so English as their second language. And there happens to be an attendance crisis in this community. 49% of the student population is chronically absent. So think about it. A lot of this has to do with either keeping a child healthy, having access to service, perhaps they have dental pain and they can't get to school, or they were sent home because they didn't have their asthma plan. You name it. And since 2020, more than 200 students have dropped out, and so this is reducing the graduation size of classes, really. So a little bit of data there just to kind of demonstrate that this is really the community where we serve the most patients. I would dare to say that about 60% of our patients come from the Fairville community, and these are the schools and the issues that the school is facing, which is absenteeism. So we know the situation. Now we're going to talk about the opportunity that's before us. And so a community school is really a community, it's a school turned into a community center with resources, after school programming. How many have heard of that concept? I think it's throughout a lot of the cities in Minnesota. So it's really an initiative, again, to turn and aim schools into a resource and opportunities for those students who have the need. For us, what that really means is collaboration. And so since 2012, our youth programming has been present in the Fairville Public Schools and other schools like Northfield schools as well. Our dental school-based care since 2015, and that's really evolved. We're about to bring out our mobile equipment again. Every week there's different outreach sites. Our students from our University of Minnesota, Mankato State location also accompany us to deliver that care. Our substance use program is also in the schools, specifically in Fairville and in Northfield, which are two of our cities that we service. And then, of course, our staff are involved in coalitions and projects throughout the Fairville Public School District. So this is really an opportunity that is ripe for the taking, and to be able to serve this community in a way that's to deliver our services specifically in the school. So those of you that might not know what a school-based health center is, it's really it's all these programs coming together. And so it's a safety net care delivery model that is located in or near a school. So we will actually be located at our Fairville High School. So we'll have a clinical site with a medical room, a dental operatory, a lab, and so forth.
All right, hello everyone. Okay, my name is Fausto. I'm just going to talk a little bit about what we do at the schools. So we have two forms of outreaches. We have an education outreach, and then we have a clinical outreach. At these education outreaches, we teach the kids how to brush their teeth. We go over brushing, flossing. Sometimes some of the kids have never seen floss. They don't know what a toothbrush is even. So it's very, very eye-opening what we get to do there. I even have a story that sticks with me all the time. We showed a 5-year-old girl how to brush using small little circular motions on the bottom. And later that week, I got a call from the mom saying, hey, you know what, my daughter came home and she taught me how to brush my teeth. I didn't even know how to do that. So, it just, what we take for granted daily, just normal oral education, it's huge for other people, especially if they don't have the education for it, which is great. So in the year 2023-24, we were able to partner with multiple schools around Rice County. And we were able to give education to 299, across 7 schools, and 202 students were seen at those clinics. So what the clinic outreaches are is we actually go out there, we do a little bit of oral education as well. but we will also establish kind of a mobile clinic. We bring all our equipment there. We use just random classrooms. They could be in our classroom, they put us in the gym, they put us in the library, anywhere. We'll set up shop, and then we pull students from classrooms, and this is all done through consents. So we send out consent forms beforehand to the school coordinators. They send it home to the parents give consent. Then we see the students there, and then we do oral screenings, we evaluate what's going on. We will do a toothbrush polish, scaling if needed, and then apply fluoride varnish. And we also fill out a form with findings for the parents, so they take it home. If there's anything concerning, we'll let the parent know via that note, and we will also follow up with them afterwards to kind of elevate the need for them to come by. But then in 2024-25, then we started seeing more schools with very gracious grant from Delta Dental that's allowed us to expand over the last 2 years. And so 9 schools, 283 students were seen then clinically, and then 233 were seen for the outreach education portion. And a lot of this too, like I mentioned, the very first time we went to the middle school, there was another student. He was super shy. He was embarrassed more than anything. And he admitted to us, this is my very first dental appointment. I've never done this, I'm terrified. So after we started working with him, he noticed how it was painless. We weren't doing anything to hurt him. He relaxed and he kind of started opening up, asking questions. And then when we returned a couple months later, he wasn't on the schedule, but he found us in the hallway. And he was like, hey, you know what you guys showed me then, it's been super valuable for me. I'm a lot more confident in the way that my mouth, it doesn't smell anymore, my teeth look cleaner, and I just really want to say thank you. So that's great. So from there then, the goal that we want to achieve, and this is just a natural fit, why it leads to us having a school-based health center, is just to be able to expand the access to the health resources for Fairville youth, and it's across all aspects, not just dental. But by having a more permanent chair also at the Fairville High School, we're removing all the barriers that could be a problem to families, like as Daisy mentioned, travel, language. We're very fortunate that most of our staff is bilingual, and we have all these providers too that can use their scope of practice to be able to help. So with this school-based health center, not only will we be able to do cleanings and screenings to that effect, but we will also be able to do restoration services, extractions, and things like that. And again, with regardless of the ability to pay insurance coverage, immigration status, we're all doing this in accordance with federal, state, and local law as well. So it's kind of a dream come true for a lot of us.
Yeah, so like Fausto was saying, right now we're going into the school without the actual chair set up, and we just do a makeshift. And it takes so much collaboration between the school and Fausto finding time, and the coordinators having to get the kids and everything, but it has been so worth it. And I think this is one of my favorite parts of being at HealthFinders is we've seen it come full circle. We have examples of where we've gone to a school, we've seen a kid who had a lot of need, sent that letter home, and the parents actually did follow up. And the child came back to our office, got x-rays. I remember completing a full treatment plan and then going, all right, well, let's get you in for your 6-month recall, we'll get that scheduled. So now, instead of putting out fires, we're doing prevention. We're getting them established at a dental home. And for people that might have had trouble finding that in the first place, or might not have even looked until they had an immediate problem. So that was, we're seeing more and more of those stories happening with kids, and that just warms my heart. Specifically, we had a kid who had recently moved from another country, and the nurse was even involved, the school nurse. She came up to me and she told me how much pain this child had been in, and they had a cleft palate, and part of it had been repaired in their previous country. But when I looked in that mouth, you've all seen a kid where there's a lot going on, and that image is just burned in your memory. And I can just picture this cleft palate, the teeth being pushed around, disfigured, and then beyond that, the amount of decay that was going on too. And she was talking about how this kid was always in pain, and to think he doesn't know English. How are you even supposed to learn another language if your palate's not even in the right form and your teeth are decayed and you can't learn to talk? And so from there, I was able to at least reach out to Daisey, because this child didn't have insurance either. So where are they gonna find a specialist that they could afford? Good luck. And Daisy, being the insurance navigator, got right on it, figured all that out, and they got the child seen at a Shriners Hospital who took care of all the work for that kid and his family. So I just think like how amazing it was that we were able to find this kid in this system and help get the care that he needed. So with that, our different ways to innovate care delivery, and we talk about trying to be really good hand holders, because there's a lot of barriers, and so some of them, for example, like language. A lot of our patients, English is not their first language. I think it's amazing that our staff is bilingual, a lot of them. Even our nurse practitioner, she did not know Spanish, and she spent years learning it. She even recently went to Mexico and immersed herself, and I would say she is fluent. And patients are going to be much more open and, you know, engaged when their provider can speak to them in their own language. I think that speaks volumes. Finances. We offer a sliding fee scale for anyone who's not on insurance. You know, I think of really, for me, it's usually the kids that I'm like, oh my gosh, when they come in and they don't have an insurance, and we do the best that we can to try to keep them in-house rather than referral. Because if a kiddo needs a tooth out to get to a pediatric dentist without insurance, I think just for a limited exam, one x-ray, nitrous, and the extraction is gonna be almost $500 depending. And so luckily we can offer this for a fraction of the cost and get that kiddo out of pain, get infection controlled. And then, you know, also having our insurance navigators, I run to Daisey's office with like, here's another patient, let's get them called, let's get them figured out. So then distance in transportation. So, you know, now that we're gonna be able to go into the school, it cuts out having to pick up a kid from school, bring them to our clinic. Lots of times when families do that, the kid will miss school the whole day. They won't even go, even though their appointment's at 2 o'clock or something. The other week I had a mom and son, it was the 6-year-old's appointment, and they showed up 20 minutes late for an hour appointment. My assistant comes back and she's like, do you still wanna see them? And I was like, yeah, they've got a lot of need, like let's just try to get something done. Mom comes back, she is in tears. And she said, I'm so sorry we're late. We only have one car. My husband needed it for work. I looked at Ubers, it was just so expensive. So they rode their bikes. They got on, the 6-year-old was biking down the street to his dental appointment, which just boggled my mind. And there was, our whole office is covered around road construction right now. So they got held up because of that. But I thought, wow, she really cared. She wanted to get her son seen, and she was willing to do anything, including putting him on a bike and get into the office. So if we can help cut that barrier down, that is a huge goal. And then confusion with the healthcare culture, you know, referrals, things like that. Patients don't always understand what referral means, or using certain terms like pediatric, especially if you don't speak English. You may have no idea what that means. And so trying to do the best we can to prevent the need for referral, or if we do need to, like, you know, knowing exactly where I can send somebody, giving them the exact phone number that they need to call to set up an appointment, trying to eliminate any possible confusion. And then even with our healthcare culture, like getting insurance. I remember being a 26-year-old getting kicked off my parents' insurance, and I was crying in the 8th floor in the corner of Moose Tower because I could not figure out MNsure. And at that point, I already had a master's degree. And I'm like, okay, I speak English, I'm well educated, and I cannot figure out how to get insurance. And it was my mother who called and helped me figure it out, thank God. But then you have people, you know, who don't speak English, and that even translators on a phone can make things so difficult. So I'm really happy that HealthFinders, we have different ways to try to navigate all these different scenarios.
Extending the reach a little bit and driving that value. So we always give shout outs and kudos to our partners, folks like Delta Dental, University of Minnesota, Mankato State, and our healthcare partners who help us deliver this care. We wouldn't be able to do a lot of what we do without them. So they really do expand, you know, that reach for us. And so across our region, or the service area that where we reside is 3 health systems, 2 public health agencies. We see a total of 3 school districts, obviously social service agencies, and community pharmacy. So we have partnerships, that see us and that they find our mission helpful as well. Longtime mentor of ours and support of our organization, previous board chair, used to describe the relationship between our partners and ourselves as a hand in glove. So they went together. It's a perfect fit because where they couldn't reach, we could reach, and vice versa. And so without those partnerships, it would be really difficult to be able to do what we do and the care that we deliver. Another, I think, partnership that has really developed over the years has even been with our payers. We've done trainings and many other things with payers, but specifically one of our payers to the south has had challenges in supporting, the recipients for medical assistance in Minnesota Care, and this specifically in Steele, Waseca, Dodge County to the south. And so with them, we've been working through emergency room referrals for dental patients who either don't have a dental home or are frequently there for dental pain, and there's not much an ER can do besides maybe give you some pills or something to kill the pain for the time. We've also worked with them throughout the big de-enrollment or disenrollment of last year and even this year to be able to help their recipients keep coverage and make sure that they don't have a gap in that coverage. And then of course, this challenge was also with language barriers and making sure that the recipients were supported in accessing the resources that they needed, including transportation and many other things, which our community health workers and our staff or care coordinators, who most of them are bilingual, English and Spanish, English and Somali, were able to support their patients. And then one of the things that we've been working on with specifically the school-based health center was really to streamline the work and the things that we are doing. We've developed, big shout out to our boss back there, our executive director, who's helped us develop an app to be able to streamline this work. So we talk about delivering the care, obtaining consents and all of this, right? And some of that sounds easy, but if you don't speak the language and you really can't read what I'm sending you, that's sort of tough. But all of us really have a phone, and including our patients and our parents, they have a phone. And so we can send them the link, they can get into our app, sign up their child for the next dental clinic, have consent and everything all rolled into one. And so it's really streamlining the process, making it easier for our partners too. Our school, community school coordinators sometimes had challenges. If you have a child in school, you find things stuck in their book bag all the time, and you don't know what half that stuff is. And so that is part of what we can help our partners with as well. And they're busy; they deal with children all day long, and so helping them in that is something that we've been working towards. And so this year we were able to launch the actual app and get things a little bit more streamlined.
So what's really exciting, we started this year partnering with the University of Minnesota School of Dentistry. About each month we get 3 dental students who come and stay for 4 to 5 weeks. And then along with that, we've been getting dental therapy students from MSU Mankato, as well as hygiene students from it as well. This has been super critical for us to be able to expand our needs as well. As been talked about in other presentations, there's a shortage of dental providers, and our team is great, but we can only do so much. And so having these students helps, they come with us on outreach, or even if some of us are on outreach, some of them stay back and can keep seeing patients in our clinic, and it just keeps the flow going, which is cool too, being students, sometimes you're stuck in your own little world, and to just be immersed into real world applications, things that are actually going on, they are, get a little taste of something that's not their norm. So, yeah.
And here's just a quote from one of our students, Dr. Daisey shared with me a few months ago from one of our rotations, that we were the #1 highlight for dental school. Oh my gosh, that's a really long time to be in school, and we were your highlights, and I felt really good. And then blurry pick, but some of the thank yous, the shout outs of these students, I think some of them have made friendships and relationships with us. One of the first chats that we heard, they're like, we hope that those students will find the love of their life or something where they're located. We say the same thing. We're like, we hope they find a reason to stay and come back to this community and work for us, or find somewhere when they're eating, downtown at Janice or something. So, we hope to see that too, but we love having our students, and it's been an awesome learning experience. Both universities have been super supportive, to our preceptors as well. So, and what part can you play in this? We ask that you follow us on our social media platforms, stay informed on what we're doing. When you're there, you're on our website, join our newsletter so you can get news on what's happening. I don't know if most of you are up here in the metro area, but just what's happening in the south of Minnesota, and spread the word. We're always taking dental volunteers. I know too, a couple of the folks that presented today have talked about how difficult it is to hire assistants, licensed assistants, hire volunteers, or just hire dental professionals. It's been really, really hard. And then lastly, of course, we're always taking donations. Let us know. Please check out our website and follow us, like I said, in many of the platforms that we're on, Facebook, Instagram, all of that. So, are we on TikTok? No TikTok just yet, but we'll get there. But yeah, so.
Actually, we might be. The dental students have made a few TikToks in our office.
We're not officially, but we're there. Thank you all so much. Oh, you okay? You're so excited to follow us. That's just. Thank you all so much for having us today, and we will open it up for questions. Also recognize we're the last people we see today.
As for was your clinic the organization that kind of initiated that school-based health center, or was that a need that the community kind of came up with and then you came alongside them? How did that get started?
I think the opportunity came via grant and many other reasons, but our services were already there, years past. You saw that our youth services have been there supporting public schools with after-school programming and many other things since 2012. Our dental program has been in the public schools in Northfield and Fairfield, and then local Head Starts as well. I think that's one area we didn't really touch on, but the local Head Starts as well since 2015. So it's really just a natural next step. And then, of course, in support of the public schools, parents, and with the attendance crisis and many other reasons why, it's just a natural next step to be able to deliver our medical services, which are there for sports physicals and like one-off clinics and whatnot, but not there providing the services during the week permanently. So that, to me, that is one of the biggest changes, is really having our medical, our dental providers regularly after Fairfield High School.
This might seem like an odd question, but do you find yourselves getting very many college students? Because I know there are several colleges down there in that area, and I went to St. Olaf myself, and although those are typically fairly well-off schools, I do think there's actually a high percentage of students who don't have access to dental care while they're at school.
Surprisingly, we've gotten a very low number of students from Carlton and St. Olaf, but when they do call, it's an emergency, and we will see them at our clinic. But yeah, it hasn't been a big, huge
A large
number.
number.
Yeah.
I was wondering because I know there's a ton of international students.
Yes.
Yep.
Yeah. I will get a lot of calls about insurance. So if the student has an emergency and whatnot, and also we get a lot of volunteers from Carlton and St. Olaf. Some of our dental assistants, our receptionists, our EMTs who can do intake with patients and work alongside our medical providers. So I do get a lot of requests for volunteering.
We've had great students, I think.
And dental.
Currently, two from
Who come and
Carlton.
help assist,
one from
which
St.
is
Olaf.
great.
Yeah.
We did that, and then one recently graduated and got into Harvard Dental School.
She's been a long time volunteer,
Yeah.
at least 4 years.
Yeah.
She's going to come back and work for you.
I think so.
Hopefully, that's great.
She's motivated for
Yeah.
small
Very much.
Yeah.
She was a little down for a little while and was just doubting herself and wasn't sure, and took a conversation with these guys and Dr. Jerry Appledorn, and she was right back on.
How are some of the changes
will be gone for adults, next year, so that might have a little bit of an impact, but also too, for safety net clinic, and so we're used to seeing a lot of families without insurance, without coverage. So, we'll continue to be there through the time and for as long as we can for patients who are uninsured.
Do you have any innovative ways that you have integrated kind of your services, like medical, dental, behavioral health?
The nice part about our clinic is that if anyone ever wants to come visit, you walk in and then it kind of splits. So we have like chemical health, mental health on this side, dental is along this wall. You cross the hallway here and then it's medical. So if we have a patient who's having some sort of allergic reaction or a medical crisis, we can literally run down the hall and be like, "Oh, Dr. Ripley, can we get you for a second?" She comes running down and vice versa. So it's like really, really seamless at times. And we're very fortunate that our building is set up the way it is. It's all one floor, so if we need anything across those services, we can easily call a provider to check out one patient.
And now on Thursdays, we have a dental student will follow our MD. They go with her and they kind of go into the appointment if appropriate, and they'll ask them some questions about dental or anything. We've got a lot of patients with diabetes, so we'll talk about the relation of the mouth and diabetes, and then we usually have an extra chair that day, so if that patient's there and they want to get a screening done or get some x-rays, the student will just put them in the system, bring them down the hallway, and we will start screening for something or a problem. So that's one of my favorite parts, is having medical right there too.
Yeah.
Patients don't always understand their full health histories either. Medications have such complex names, and when you don't speak the language, it's even more complex, so I often run down the hall and be like, "Can you look up this patient?" Because they often doctor where we are at HealthFinders, so they'll pull up their records, and then I feel more comfortable too, knowing I've got their accurate health information. So
Yeah, I would say too, Fausto talked about our building and the layout. Our checkout stations are designed to be able to assist patients a little closer, so you're not just at the front desk where everything bottlenecks and everybody's waiting in line to be checked in or checked out. Our checkout stations are covered by folks who are expert connectors and can handle a referral. So a patient might come and want to pay $20 on their bill. We'll take their $20 bill and see anything else. I haven't gotten my medication for my blood pressure. Can you help me call the pharmacy? Or they told me my blood pressure came up a little high back there. They told me I need to make an appointment with Dr. Ripley, and so we'll handle making the follow-up medical appointments or lab appointment as well. So those checkout stations are really critical when it comes to follow-up care for our patients.
What record system do y'all use for medical and dental? Is it the same or is it two separate ones?
They're separate.
that's why I have to run down the hall.
So for medical, I believe we use Athena Health, right? Athena Net, and then for dental, it's Open Dental.
Okay, awesome, thank you.
Yes, Athena does have a dental version, but I don't think it's available to the local clinics or clinics just yet. We're waiting, we're on the list. Thank you all so much.
You good?
Thank you.